Good evening, everyone, and welcome to this meeting of West Berkshire Council's Local Outbreak Engagement Board. I'm Councillor Graham Bridgman. I'm Deputy Leader and I hold the Health and Wellbeing portfolio, and I chair this board. I'm supported this evening by Councillor Joe Stewart, who is the Vice Chairman of the board, together with other councillors. That's Dominic Berwick, Lynn Doherty, Steve Masters and Martha Vickers. We are expecting, I think, Tracy Dashkovich, who is Director of Public Health for Berkshire West. And obviously, if Tracy turns up, she will be very welcome. Nigel, also in the room, Nigel Lynn, Matt Pearce and Andy Sharp from the council, Joe Reeves from the CCG, Sean Murphy from the Public Protection. There's Tracy. Hello, Tracy. Sean Murphy from the Public Protection Partnership and Martin Dunscombe on the comms team from the council. As always, we are being live streamed via YouTube. And again, as pretty much always, Gordon Oliver is clerking the meeting and is Zoom host. So we'll start, Gordon, on the agenda with apologies. Do we have any apologies for absence?
Yes, Chairman. Katie Summers has sent her apologies and Joe Reeves is her substitute.
And Joe turns up anyway, so Joe welcome. Seems to be a continuing theme that you're doing the vaccination report. Next, members, you should have had available and read the meeting minutes of the meeting on the 20th of December. Looking to see whether anyone has any amendments they want to propose. Yeah, you got in there. I'll take you in a moment, Councillor Doherty, on agreeing them. No one seems to have any amendments, so I will propose them the chair. I think Councillor Doherty is indicating that she will second them. Usual format. All those in favour, please vote by sticking a hand up. Thank you. You're not agreeing them. Were you there, Councillor Doherty? You're going to stick your hand up? Yeah, thank you. And Gordon, as you always, I will, you can append my electronic signature. One thing I will say, however, Gordon, I know this is a product of the software that's used for these things, but if you take a look at the bottom, it tells us that the meeting commenced at time not specified and closed at time not specified. So just, tidy that one up if you would. Thank you. Right. Members, declarations of interest. Does anyone have any interest they need to declare? No, as usual, no. Right, so we get on to, as always, the main agenda items, and we start, again, pretty much as always, with a COVID-19 situational report. So Matt, over to you.
Thanks, Chair. So I've only got a few slides to share with you this evening. The first one, the summary slide, just showing each of the local authorities across Berkshire and how we compare to the regional, the South East and the England average. So just starting on the left-hand side, I've highlighted West Berkshire. The testing rates are going down across all local authorities at the moment, and that could be down to a number of reasons which I'll come across in a minute. We have seen quite a significant demand, as you would note in the national media, for PCRs and lateral flow devices. Our positivity, so the proportion of people that test positive when they test is around 32.8%. So that's by far the highest positivity we've ever seen. Just for a bit of context, when we last met, the positivity rate was around 10%. So a threefold increase. And again, you can see the positivity rates increasing across all the 6 local authorities across in Berkshire, as well as the regional national average. And national average is around 34.5%. So high proportion of people testing positive when they test. Cases per 100,000, again, all ages. So when this data was taken, it was 1449, we're at 1498. So again, we're continuing to see significant increases. And again, for context, last time when we met, it was around 560 per 100,000. So a threefold increase in our rates. It just shows you the speed and the spread of this new variant Omicron, which we're now seeing in the vast majority of the cases in West Berkshire and across the country. That corresponds to similar to the South East average, which is around 1469, slightly lower than the national average of 1709. And then in terms of the cases per 100,000 for 60 plus, again, we're always interested in this age group because we know that they tend to suffer the worst outcomes as a result of COVID. So we are actually lower than the vast majority of local authorities in Berkshire and the regional and national average. So we're just doing some data analysis to understand why that might be the case. So we're currently at 656 per 5.5 per 100,000. And again, we're seeing increases across all local authorities and regional and national average. So when you look at the numbers, again, we are seeing huge numbers here. So around 3,300 in the last 7 days. So that equates to about 300 cases per day. And obviously, I'll go on to talk about what that impact is in terms of hospital admissions and deaths further on in my presentation. But we are seeing lots and lots of people. And that obviously has consequences, as we know, in terms of how business operate, number of staff being off, and so forth. So we just need to be aware of that the consequences elsewhere in the system, not just people getting ill, but taking time off and how that affects the economy and so forth. Oh, sorry, come back. So again, the epidemiology curve, it just really shows you where we're at. And again, you can just see the number of cases we're seeing now is far higher than we've ever seen throughout the course of the pandemic. The grey bar just showing that English average, the orange bar representing the southeast, and then West Berkshire on the blue. So we're still going up. It's really hard to predict when we might peak. Obviously, there are some indications that London might be peaking, but we still need a few more days worth of data to see how that pans out, and we're potentially a few weeks behind that. So likely increases for a few days yet to come. And then just the epidemiology of cases, which I'll show you. So the ages on the left-hand side, the dates on the bottom, and you can just see that the darker patch is just showing the higher rates per those ages, and you can just see that spread as we move across from October right the way through. You can just see the darker patch is just increasing up the age range. And I think that's just where there's still a lot of unknown. Obviously, the vast majority of Omicron has affected the younger age groups at the beginning of this wave. And I think there's just a little bit of uncertainty about what that impact might be as more older people get Omicron, but certainly the vaccine is proving to be highly effective at this moment in time. And obviously, we've had our schools go back over the last week or two, so we get to see the first routine testing as part of their return last week. We're starting to see some cases come back, and we're just waiting to see what that transmission will look like in schools as children start to mix. So we'll wait to see that data come through possibly over the next week or two. The hospital data, we are seeing quite a significant rise in hospital activity now. So the patients in hospital on the 1st of December, so slightly lagged behind this data. There's 75 patients. This is in the Royal Berkshire, and I recognise the patients go to other hospitals across the rest of England, but this is just for the Royal Berkshire. There's 75 patients. And again, if we think back to the last time we met in December, that was about 32, so about half. You will always see patients in hospital with COVID just because it is so prevalent at this moment in time. The number of patients we are seeing in hospital aren't as severely ill as what we have seen in previous waves. We're not seeing as many patients on oxygen either. And those we are seeing in ICU tend to be partly vaccinated or not vaccinated at all. So again, just emphasising the importance of that vaccination. And again, if you look at the patients, the second graph down here, it's the patients admitted to hospital the 2nd of January. That was 8 patients. So it's not huge at this moment in time, but the activity is going up. And because winter pressures always are difficult for hospitals, anything that comes on top of those winter pressures will obviously put hospitals at a greater risk, and also a number of staff being off. And then there's 5 patients on mechanical ventilation as well at this moment in time. In terms of deaths, obviously it's sad to report any deaths. Fortunately, over the last week, there hasn't been any West Berkshire residents. There's been 283 COVID-related deaths since the start of the pandemic. And then this chart, which you will be familiar with, we've got the rate per 100,000. The grey bar representing the 5-year average, and you can see that we're in line with that 5-year average. The blue bars sadly indicate deaths across West Berkshire. So again, it's a fortunate position at this moment in time that we're not seeing the extent of deaths that we have seen during other parts of the pandemic. Last but not least, I just thought just do one final slide because I recognise there's some confusion. I think guidance changes so quickly. I thought it might be just helpful just to confirm what's happening with regards to the PCR tests, because they're going to be temporarily suspended for people that test positive with a lateral flow test, and that is actually from tomorrow. So people who receive a positive lateral flow device, so those are the tests that people take at home, they will still have to self-isolate immediately, but they won't require to take a confirmatory PCR test. So they won't need to order a PCR test online, and they won't be required to go to Newbury Showground, for example, to get a PCR test. And this is only a temporary measure. It did happen actually last year, some of you may recall, and that's mainly because prevalence is so high of COVID-19. We're very confident in the accuracy of those lateral flow tests, so it's highly likely you will have it, and therefore we're not asking people to get a confirmatory PCR anymore. But what's really important, because obviously what we need to do is make sure we keep an eye and track what's happening when people test, is that they need to report them on the gov.uk website. So importantly for our surveillance records, but more importantly so that Test and Trace can make contact with them and identify who their contacts are. So there are some slight concerns that people might do that, but it's really important that people do, for the reasons I just mentioned. And one of the reasons this is really good is it actually will help ensure that PCR tests are available for those that need it. We have seen considerable pressure on our PCR testing sites online, as well as our lateral flow tests, and I'm happy to take some questions on there. There are some exemptions to that at the bottom here, is that if individuals want to apply for a £500 test and trace support patient, they still need to get a PCR. And equally, they might be asked if they're a clinically vulnerable group because they might need early access to treatment or they're part of research. And the final one is if they're arriving to the UK and their day 2 LFT is positive, and that's really because we want to test for variants. So that's a very high level summary. Obviously all the information is available on the gov.uk website, but I'm aware that testing is becoming increasingly complex and what people need to do. So that's all I'm going to cover today, Chair. Thanks.
Thanks, Matt. Yeah, I mean, at some point during this evening's meeting, I was going to make one point, and I think I'll make it now, in anticipation of what in reflection of what you've just said, and anticipation of what Joe is going to tell us on vaccinations, which is, and I'm sure I'm preaching to the converted in the room, and probably preaching to the converted for those who are interested enough in this stuff to watch LOEB. But if you haven't seen the Royal Institution Christmas lectures with Jonathan Van Tam, make a point of going out and watching them, because it is an absolutely fascinating reflection on the epidemiology of COVID in particular, and the vaccination program, and how vaccines work and everything else. So if you haven't seen that, make a point of watching it. Right, members, questions for Matt. Councillor Vickers.
Thank you very much. And yes, I've seen the lectures, Graham. I thought they were very good. It's sort of, obviously it's sort of aimed at older children, but it was really good, and the way they explained things.
That's probably why it suited me, Councillor Vickers.
It's very good. Now, I mean, very simple question is about the availability of testing kits. They're still not, and are they still sitting in a warehouse somewhere? I mean, what's going on? Because, I mean, in Newbury at the moment, rather than the Health Watch van and the centre in Kennet Centre, they're just calling people in. They say they'll test people, but they're not giving out the kits. I'm told that they're just still very hard to come by. What is the situation there? Because some people do need them on a regular basis.
Yeah, thanks, Councillor Vickers. I was going to do a few slides on that, so that question might come up, but you're right. I mean, there still is there is challenges in the supply of lateral flow test kits at this moment in time. What we're doing and what the government are doing at the moment is prioritising where those kits go. So at the moment, obviously, the focus is on supporting those people that need to self-isolate to do their daily lateral flow testing so they can get out of isolation early. And particularly that's important for staff in terms of hospitals, in terms of social care. So that's really where we're focusing the supply of those kits. So I know that testing channels have become available and those individuals now have good access to lateral flow test kits. I understand the position of pharmacies is improving over time, and I think the supply is coming out. I think we're hoping to see an improved picture towards the end of this week and hopefully into next week. I recognise that's difficult and challenging for some people. I know on the online provision, I think if people do persevere, they do eventually get a kit. They just release them in batches because I think it's logistically challenging for them to distribute them all the time. So I think it's just been a combination of a change in policy, a growing prevalence of COVID-19 across the country has just put huge demand on the kits, but we are hoping that supply will improve. You mentioned Kennet there, and I think that is a real opportunity for people, so they can go to the Kennet Centre and get assisted testing. But as you say, it's just assisted testing, but nevertheless, they can still get a test on that day, and people can show them how to do that. And I think that's really important as well, because if we can all test more efficiently, we're more likely to have an accurate result. So I'm hoping over time the picture will improve, but I completely recognise that it's difficult at the moment to get hold of kits, but I can only advise that people try all these different channels to try and get hold of them.
Thank you.
And I'll reflect that the messaging we had out of the centre was that there had been a national increase for January and February from 100 million to 300 million kits. So they should be flowing through. And certainly the messaging I've had out of the Royal Berks is that they are fully stocked for kits for staff. So there's no difficulty with staff at that particular NHS acute trust getting hold of kit. And personally, I ordered a box of kits and picked them up later the same day. So, you know, I think it depends when you approach the system and what the current situation is locally. But I had no problem with that myself personally. Councillor Masters.
Thank you, Chairman. Yeah, just to echo the concerns of Councillor Vickers. You know, the number one concern, reference COVID from residents, and I'm sure other members have had this, is the availability of tests. From pharmacies at times, and being able to get them from the mobile units quite as readily. So I just wondered what the council were doing, and is the council being proactive and public health being proactive up the line in terms of ensuring that the government and whoever is responsible are getting the message, because I think people are testing and people are very keen to test. So I think there's a lot of, excuse the pun, a lot of positives to come from the fact that people are chasing members for advice on availability of kits, etc. So I think that's reassuring, and I think we need to be encouraging people to continue to try to do that. So I just wondered what we were doing as a council, liaising with public health, etc. So.
Well, let Matt and possibly Andy come in on that one.
Yeah, I mean, we're in frequent contact with the regional and national teams, Councillor Masters, and I think everyone knows this is an issue, and we obviously, it's difficult for us because we want to encourage people to test, and the availability of testing makes that difficult, which is why we just need to be careful about reading too much into our numbers over the next few days, because that might not represent the true picture of COVID prevalence in our society. I did just want to make the point, actually, the public health team have worked quite hard, so we've allocated kits to primary care. Obviously, we're working across the council to make sure key essential workers get their kits. There's going to be a new channel open for essential workers to get hold of kits going forward in the future, and we've also actually had some mutual aid from Oxfordshire County Council as well to provide some kits. So yeah, we're escalating certainly upwards, and we're also looking and using mutual aid across the rest of the district just to make sure that those people do get it who need it, and we keep the kind of economy going. Thanks.
Thank you both. Anyone want to add anything to any of that? No, fine. So we move on to the vaccination programme and an update from Jo on behalf of Katie and herself, no doubt. Thanks, Jo.
Thank you, and thanks for having me back. Can I check you can see my slides?
We can, and looking at your thing in chat, we can hear you as well, which is great.
Good. Apologies in advance if my audio bumps out. Zoom didn't like me this morning. Just starting with some headlines on the programme. We have offered all over 18s a booster dose by the deadline of 31st of December 2021. I guess what that looked like really is that a couple of weeks before Christmas, we're very, very busy. And then we found the week in between Christmas and New Year, our demand started to tail off. So unfortunately, we did have some clinics that had spare appointments available that weren't quite filled. But I think we can make some inferences about sort of demand over the festive period and what people might have been doing with their time. But we have seen some, since the Christmas period, we have started to see some DNA rates, so did not attend rates. So those with booked appointments that are then not arriving. So we're doing some work to understand the reasons for that. Speculation may be that these individuals have tested positive for COVID in the last 28 days. They may have had an appointment on a walk-in basis and not cancelled their appointment, and it's not kind of all linked in the system. But there continues to be good appointment availability and good walk-in availability locally and as part of the region. So Broad Street Mall Mass Vaccination Centre has reopened for walk-ins. Strawberry Hill on their clinic on Wednesday will offer walk-ins, and the Kennett Centre Pharmacy will offer walk-ins this weekend if you are yet to get any dose. In terms of 12 to 15-year-olds, they are now eligible for a second dose 12 weeks after their first. They also need to wait 12 weeks after a positive COVID test in order to get their second dose. And the way to access that vaccine will be either through booking an appointment through the national booking system or waiting for a visit from the school immunisation team at school. And they've been leading on all the paperwork and writing home to families, I understand. Focus now is really shifting towards inequalities. So both in terms of equal take-up of booster doses, but also doing what we can to go back round to those who still need a first or second dose. And just to touch on the Hungerford pop-up, as I'm not sure we've met since that's closed, just to summarise that 7,549 vaccines were delivered overall, which is over double what I'd forecasted we would do. So big thank you to particularly the Hungerford Cricket Club. The chairman, Andrew Burbidge, locally known as Melon, was incredible and really supportive. So I just wanted to say thank you very much. And the whole community, nothing was too much. If we needed lanyards or bacon rolls, somebody locally was really helpful. And a final thank you to the Newbury Racecourse volunteer coordinators who stood up again to look after us at Hungerford, and they've been looking after a lot of the surgery's volunteer needs as well for vaccine clinics. So they've wrapped up now. So I wanted to formally acknowledge all their hard work over the last year and to say thank you. So in terms of take-up of boosters, I've only got a couple of data slides. So this table shows us take-up by primary care network, and they're grouped into loosely local authorities. So these are PCN registered populations rather than the population of the West Berkshire local authority area. But as at the 5th of January, it was shown that 81.7% of our 4 primary care networks had taken up their booster. So that means that they would be aged over 18 or 16 with underlying health conditions and 91 days since their second dose. So comparing to Reading at 67.9% and Wokingham at 80.6%, we're doing pretty well. So I think that's really good and reassuring to see. This I've just stolen from the government's coronavirus dashboard just to show what that translates to in terms of local authority area take-up. The denominator here is all people aged over 12. Of course, not all people aged over 12 are eligible for a booster, but it does help to make national comparisons. And the England average take-up for a booster dose was around 54%. So doing better than the England average. So coming back to inequalities, my very rough collage here just shows some of the work that is going on at the moment. And to, again, sounds a bit like an award ceremony, but a big thank you to Thatcher Medical Practice, who visited the soup kitchen twice in December. And Meryl there and her Christmas pudding was excellent at getting the word out and making sure that we were able to offer a vaccine to the clients at the soup kitchen. And a couple of other things to note that is going on is Strawberry Hill, who are able to offer walk-in appointments, particularly to social care workers. There's been some phone calls around through Andy's team. We're just finding sort of small handfuls of social care workers that still need to have a booster. We are doing some work to understand better the data there about social care worker take-up, but we wanted to make sure there was a particular offer if there were any staff members that still needed a booster. Graham Jones from Lambourne Pharmacy has offered to support the racing industry and has got in touch with Racing Welfare and the, I can't remember the right word, but the Stable Yard Owners Association, and is looking to either offer walk-ups or increase their capacity, but we'll meet with him on Friday, but he's already made that offer directly to those charities. Talha Surgery, who are visiting one of our refugee hotels today, and to recognise Healthwatch West Berks and Solutions for Health, who, alongside the testing programme they support, are doing a lot of community engagement in support of the vaccination programme as well. And they were regular visitors at Hungerford, looking after the marshals and handing out testing kits. So the next stage in terms of inequalities, I think, as you'll know, a lot of our approach has been about addressing convenience and making sure that people are able to access a vaccine at a location and at a time which is as convenient as possible. I think we need to be taking a more multifaceted approach, and I think that's our plan going forwards, to look at some of those confidence and complacency barriers. We need some more focus on comms and engagement, and so across the Buckinghamshire, Oxfordshire and Berkshire West system, that's going to be a key focus going forward. We will have access to the Health on the Move van again, and so that is still available for use where we feel that that's one of the key activities that we can do. And we'll be exploring the suggestion that's come forward from a couple of avenues about sort of making every contact count approach to promote health literacy, testing, and sort of general health checks, things like blood pressure checks, etc. So just to conclude my last couple of slides, these are the locations at the top half are those within West Berkshire where vaccines are available, and the bottom, those just outside our border, but those residents who do live on the border may find those venues quite useful. And the next steps, to note that the JCVI, the Joint Committee on Vaccination and Immunisation, has recommended boosters for 16, 17-year-olds, has recommended boosters for 12 to 15-year-olds in certain categories, and first doses for 5 to 11-year-olds. And we're awaiting operational guidance, but the government has accepted those recommendations, so we are expecting to be working on that within the next couple of weeks. And happy to take questions.
Thanks, Jo. I think I'll just a couple of reflections and then one question which you're aware of because there's been some email traffic about it. The reflections, firstly, I take it, looking at the numbers, it looks like most of those who have had a second dose and are above, the age range have taken the opportunity of getting their booster. So it looks like the second dose cohort are boosted. That's my reading of what you've just shown us, and please correct me if I've got that wrong. Secondly, you'll be aware that Graham Sims, the chairman of the Royal Berks Trust put out a note the other day to try to reflect patient confidentiality being taken into account, of course, that the indication was that, and I think we all know, that those who are finding themselves in hospital, and in particular those who are finding themselves in intensive care, tend to be those who haven't taken the opportunity to be vaccinated at all, or possibly haven't taken up the second dose or booster. And I think that's just a message that we've reflected in this board a number of times, but the data seems to be there to back that up. The question I had, and please, as I say, Joe, please correct me if I've got any of that wrong. The question I've got from you, which you won't be surprised for, you've in your last slide, you referenced those who are contacts of the immunosuppressed. And you know that we had an inquiry about immunosuppression and how that related to having a fourth dose, whether that's the third dose and then a booster or the other way around. And also the question of antivirals. Maybe you'd just like to, given that we're now in a public meeting, if you'd like to just reflect on what you responded to that so that we can then go on to other questions.
Well, I did forget what I said though, Graham, so if I'm lacking detail. But yeah, there is outlined in the Green Book, which is sort of the vaccination Bible. It does outline certain health conditions that mean that immunosuppressed patients will be eligible for a booster. So they had 3 doses, whereas the rest of the population had 2 doses as their primary course. And then 3 months following their 3rd dose, they'll be eligible for a 4th or their booster dose. So they can access that by taking a letter to a walk-in or waiting an invite from their consultant or their GP.
And the other point was antivirals.
Antivirals, again, that same list, or I'm pretty sure it's the same list of those who are immunocompromised are eligible potentially for antiviral support in the event that they do contract COVID. Their guidance was issued just the other morning, and there's a webinar for primary care or to train the GPs on that guidance. But that is in place, and I can share the links if they need to be put in the minutes.
Thanks. Tracy, I saw your hand go up. Do you want to comment on that, or is it something else?
Yeah, it's just by update of that. So I fall into that category in terms of being immunocompromised. And I've actually had a special PCR kit sent out to me. So should I get symptoms or feel that I've been exposed to COVID, I do that particular test. And if that comes back positive, I'll be fast-tracked into access to the treatments that are available. Some of them have been widely tested, and others you opt into whether you want to be part of trials at that point to progress those. So that is one way that we are trying to tackle those people that fall into that category. It's just, I wasn't aware of it until the pack came through my post 2 weeks ago. I just thought it was a really clever way of actually reaching those people directly.
Thanks for that. Councillor Doherty.
Thank you, Joe. Thanks for that, and a really useful update. I've just got a couple of questions. Well, one's a query, one's a question. With regards to cancelling appointments, so if you've done a walk-in and you've cancelled appointments, I've heard this come up a few times, that there's sort of a frustration that people are missing appointments. However, I've got it on my to-do list, so you've saved me an email. Across the course of the weekend, I've tried on numerous occasions on the NHS website to manage my appointments, not my personal ones, to cancel a booking, and I can't do it. The NHS website will not let me get in to manage my appointments to cancel a booking for my son who did a walk-in and has got a test booked in about a week's time. So a vaccination booked in a week's time. So I just think there's an issue there with the website. And I don't know if there's a simple or different way that residents can be told about how to cancel their bookings. So that was the first one. But I mean, I have tried on several occasions now to cancel that particular appointment, but I can't. So that was one. And then the other thing was with regards to the vaccination data that we have, I know that we're currently, or nationally, we're currently running a campaign to try to get pregnant ladies to vaccinate. However, do we have that information on a West Berkshire or Berkshire West footprint to know if we've got a particular need to push that harder here, or are we doing okay? I know we get so many different types of data, and I'm sure you get different cuts of data as well that we don't necessarily see at this. I suppose my question is, are we an outlier with regards to pregnancy and vaccination, or are we in line with everybody else?
I don't have that information to hand. That's something I can ask a colleague to draw out for us.
Thanks, Jo.
In relation to cancelling the appointments, the only mechanism I'm aware of to cancel an appointment is either using that website or calling 119. So if there's a glitch with that website, I don't know, but I will feed that back. I think we've discussed previously irritations about that booking system.
Yeah, and I'd reflect that Lambourne Pharmacy were reflective that, you know, that they'd like, they're a pharmacy, their phone number's available. It's not quite the same as the national system, you know, and the centres, but certainly if you booked into a pharmacy and you want to cancel the booking, at the very least phone the pharmacy and tell them, because it makes an awful lot of difference to them when they're trying to manage their vaccine supplies. Thank you for that. Councillor Masters.
Thank you, Chairman. Thank you, Jo, for that thorough overview. And again, I echo everybody's comments on the wonderful effort by the vaccination teams, the volunteers, the NHS, etc. It's incredible. My question is primarily, you mentioned Strawberry Hill doing a walking on Wednesday. Can I just clarify that that's not just for social care workers, but for anybody? And also, what times is that going to be open and available? Please?
Yeah, so they'll take any walk-in. I'm pretty sure it would be 18 plus due to the vaccine that they have available. But so they would be able to do Moderna second doses, first doses and boosters. They are open 9 till 1, closed for half an hour, and then open again 1:30 till 5:30.
Thank you very much, Jo. Cheers for that. Thank you,
And
Jo.
to the extent we can, Martin will pick that up in comms, hopefully. Thank you. Councillor Vickers.
Thank you. So that's just a one-off, that Strawberry Hill, Jo, is it? It's sort of just Wednesday.
So they're not open every day because they're not finding they need to be, and also need to balance alongside ordinary events. So once they've confirmed their clinic schedule for ongoing weeks, how many cases they get in their delivery and what the demand is, they'll be able to confirm future clinic dates and whether they're able to offer.
Okay, well, that's good. I had a little issue, which my apologies, I've raised it before, I possibly have. Do we offer any support to people who have an aversion to needles? Which seems an odd question, because how would you know? Because they just won't turn up. But I mean, I think, you know, we have come across one or two who come along with a sort of relative who then, and some very patient health workers who talk to them. There is a facility now for people for non-needle jabs, or is that quite rare? I think I saw something on the news. I'm just wondering what proportion of people there might be out there. I'm sure there must be a reasonable number who just aren't turning up because they're frightened of needles.
Yeah, I'm not aware of any figures or research that's been done to kind of model local figures, and I would have to go away to discover if there is a particular pathway. I do know that any team is really understanding and do their best to make the patient comfortable. Will make whatever adjustments they're able to support that patient. So if anyone is out there, you know, just be assured that the team will look after you wherever you go. And get really good feedback. But in terms of a specific pathway, I would have to go away and find out, Martha.
Because they've got to actually turn up. And what about the facility for doing something with that? Is that just a very early stages? I saw something where you could get a...
Yeah. I don't know. I don't believe that any product is licensed that is not intramuscular injection.
Thank you.
Thank you. both, and I think that's questions for you, Joe, on vaccine, so thank you. So we now move on to Sean, Public Protection Partnership, and the latest from the front line, as it were. Not that Joe's not on the front line and Tracy's not on the front line, and to some extent we're all on the front line, but go on, Sean.
Thank you, Chairman. Yeah, I've just got a quick verbal update for the board, if I may. So we did cover over the Christmas and New Year period in terms of risk setting. So we were monitoring effectively all of the notifications that came in from settings such as care homes and from PHE themselves. And we had a number of colleagues actually that were working across the council basically to be able to pass those on to in terms of subject matter experts. So there weren't that many over the Christmas period, but there were a number came in around care settings, and we did work with colleagues from social services to deal with those from the care team. Just looking at kind of contact tracing, we did push some of those calls back to the national system in line with a lot of local authorities for the immediate Christmas period. But we came back online straight after the Christmas period, and we certainly covered over the new year. Sort of New Year's Day and the bank holidays around New Year as well, the bank holiday around New Year as well. So it took a little bit of time really to kind of get the work flowing back through again. But in the last 7 days, we've dealt with 198 local contact tracing cases for West Berkshire, and in fact, actually now we've added some more postcodes to the model we've got for local delivery. In fact, that number is increasing quite quickly, and today we had around about 80 came through. So we expect that to be probably the sort of figure we'll be looking at for the next few days, and we've increased capacity to deal with those. The one variable, of course, that we don't know is, and Matt alluded to this earlier on, is obviously the need for confirmatory PCRs. Effectively, the advice is changing with effect from tomorrow, and what we don't know is the effect that will have in terms of information coming through for contact tracing and for isolation calls, should people not register the results of those lateral flow tests onto the system. So I like Matt, would really ask that people do that for a couple of reasons. One of them is obviously it helps us in terms of picking up any tracing work, but it also allows us to have a conversation with residents, which is quite important, because actually, for example, if some of the exceptions that Matt alluded to basically apply, where people may need to access grants and everything else, then through our calls to people, we want to be able to have the opportunity to explain that to them as well, and what steps they need to take, as well as understanding really whether they need any support. So just in terms of isolation calls, really for the last 7 days, we've dealt with 768 of those in terms of contacts with people, of which we've had around about 450 individual discussions. So it shows obviously the level of work that's going on in that area, and those conversations are important, and the feedback remains very strong in terms of the conversations that we have with people. We also basically are still looking at some settings where there are identifiable incident reports or outbreaks, and we're working with colleagues from Matt's team basically to identify those settings, and we are actually making visits where necessary to those and having conversations with the people that manage those settings. So just moving on really to the other side of it, which is the compliance work. Clearly there aren't very many actual hard and fast rules in place at the moment, but obviously we have the Plan B work, the Plan B rules that came out before Christmas, and obviously it looks like they may well have been extended, or may well be extended now until the end of January. So we are continuing to do a little bit of work around that. So I think prior to Christmas, I explained that we've been working, for example, with the racecourse around COVID certification. Obviously, they had a meeting on the 29th of December, which is one of their bigger meetings. We did attend that, and I'm pleased to say all of that worked well with the plans and assessments that have been put in place with them. Just on events more broadly, I think I alluded before Christmas that we were getting to the point where we would probably hit around about 300 events for the PPP area since April the 1st. We in fact basically reached 309 by the end of December, of which 164 of those were in West Berkshire. So that's a huge piece of work in terms of going through all the event management plans, the risk assessments, and in particular the new work around the COVID risk assessments. And I just want to thank colleagues from Public Health and others that basically supported a lot of that work, as well as the event organisers. So I think it's fair to say that obviously those events, some of them quite small, but some of them quite big as well. basically went off by and large without too much issues really in terms of COVID. So that's already other matters. So that's a really good piece, and I'm very grateful to colleagues for supporting. The events, interestingly enough, actually talking of events, the proposals for some of the events this year are already now starting to come in. We thought we'd get a few weeks, thought we'd go quiet for a few weeks, but no, they're now starting to come in. And interestingly enough, in the plans that we're starting to get through, people are still thinking about potential COVID mitigations, whether what will be needed come the event season, I don't know, but at this stage people still are submitting plans that still give some thought to that, which is a kind of positive sign. So I think really that's my update, Chair. I'm very happy to take any questions, but the next few days actually will be interesting to see where we are in terms of the changes to the PCR rules and what effect that has on notifications. Thank you.
Indeed, as always, we live in interesting times, and I see no one putting their hand up to ask you a question. So in the words of Councillor Graham-Pask, we've let you off lightly, Sean. So we move on, ladies and gentlemen, to Martin and comms. Martin, you think you've got a quarter of an hour, you're not using it all, so just crack on, mate.
I thought after all these meetings. Okay, like Sean, I have a short verbal update for you today. And as always, it won't come as a surprise to you to know that our communications is focused very much on supporting those operational activities and challenges which have been sort of previously discussed earlier in the meeting, and this time primarily around vaccinations and testing. So since the last meeting, we've, as we've heard, sort of seen a big uptake in people wanting to get their boosters, to get their tests as they met up with family and friends over Christmas, and very much since then as well. So our messaging has very much been around letting residents know where they can get the lateral flow testing kits, whether that's sort of through pharmacies, sort of through postal deliveries, what that availability has been. We've had kits for collection through the community assisted testing service for people to pick up from community locations, as well as having the Kennett Centre service as well. So very much promoting those. And in terms of vaccinations, again, promoting those pop-up clinics and walk-in clinics as and when they've been available. So Hungerford is a very good example. Joe mentioned earlier 7,500 sort of vaccinations in the Hungerford pop-up. So very much supporting Joe and her team, letting people know that the Hungerford pop-up was open, how they could book, and also when the dates were extended, making sure people knew that they had longer to get their booster booked in. I think that's going to be still very much a focus for us over the coming weeks, moving forward, looking at the rules and the guidance which do change regularly, sort of making sure we're keeping up with those and helping keeping it fresh for residents as well, so that they know sort of the latest steps that they need to take to keep themselves and others safe. And the PCR test that we've discussed, which changed from tomorrow, is a good example of that. So very much keeping moving things forward as and when the guidance changes, and trying to keep residents on board with the journey as we continue over the coming weeks.
Excellent. Well done, well done, Martin, for a short and to the point. Members, anything you want to? Councillor Vickers.
Thank you for that, Martin. It's just about getting the message out. I've been trying to sort of circulate the content of the quite powerful email that Graham, Councillor Bridgman, sent out about protecting the NHS by getting your booster. So I've been I have been asked whether there's the council might be producing any posters to publicise this, but I know we don't do a lot in the way of posters, but occasionally they can be very useful. I suppose it's how you present that message on a poster. Are there any other ways that I missed a bit of what Martin was saying because I wasn't very clear on my computer, but are there any other ways of getting the message out there? I thought that email in particular contained quite a strong message, because people still don't, I think, get the message about protecting the NHS, about keeping workers out there, about the effect it has on other illnesses and on our hospitals.
it's a good point, Councillor, because we haven't got any plans to do posters as such, but we have, or certainly the message has been circulated to councillors and other stakeholders, and we are having a look at how we can share that message more widely. That's a discussion that's still taking place, and I'm sure next time we have our COVID newsletter, we'll be looking for opportunities to read that message in there as well, and very much in partnership with our colleagues at the hospital and in the NHS too.
Thank you.
Thank you.
Thank you both. And Martin, that's something I might pick up with you outside this meeting if we can. So if you can just maybe tomorrow we'll pick that up when we do the media thing. Okay, members, my note says Chairman to canvass views on the need for future meetings. I think I've already decided we need another one. And the reason I've decided that we need another one is because we are sitting with a trebling of the positivity rate from what I thought was already a pretty high position. And I think we need to know what the extent of, in particular, Omicron is within the district going forward in order to analyse what we as a district should do, if anything, about it. And in particular, I reflect that I want to just keep that eye on hospitalisations and the effect that the vaccine programme, because I think it is the vaccine programme that is having the majority of the effect, is having on hospitalisations and the pressure on the NHS and on those who are finding themselves in ICU. So unless anyone is particularly going to demur from my position, we will, Gordon, please schedule a meeting for the 24th of January and come back and have another discussion about whether to continue meetings after that, to the extent to which we are living with COVID. One of us, I think, is possibly living with COVID at the moment, Councillor Burke, but there you go. I saw your hand raised. Did you want to say something?
No, it's a slip of the mouse.
Righty-ho. Unless anyone has any other business they want to raise, I see no one putting their hand up. I thank you for your time. I call this meeting to a close, and if we could stay in the room, in the virtual room, until Gordon's confirmed that we've stopped streaming, I'd be grateful. Gordon.